Renal clearance. Although there can be many methods by which the renal functions can be assessed, this session is going to be focused on the renal clearance. Particularly, we will be looking into what clearance is, how can we calculate it, and how it can be used to estimate the GFR, renal blood flow, and renal reabsorption of different substances. So beginning from what renal clearance is, we define it as the volume of plasma that is completely cleared of the substance by the kidneys per unit time. So if we take the example, this is a plasma volume, let's say 5 ml, and we want to see that how much of this 5 ml was completely cleared of glucose in 1 minute. That will be the renal clearance. And this is going to be specific from substance to substance. Renal clearance is not a single value. Renal clearance of different substances would be different, of course. This we can use to quantify the excretory functions of the kidney, to quantify the renal blood flow, GFR, tubular reabsorption, and tubular secretory characteristics. How can we estimate renal clearance? By using this very simple formula. To calculate the renal clearance of a substance, we need to have the urinary excretion rate of that substance divided by the plasma concentration of that substance, where the urinary excretion rate is equal to concentration of the substance in the urine multiplied by the urine volume. So it comes out to be clearance is equal to UV divided by P. This is the concentration of substance in urine, urine flow rate, concentration of the substance in the plasma, and this is the clearance of the substance. This is an example, and you can calculate the clearance of the substance inulin based upon the values given. You just need to multiply these values and find it. So let's put in these values. The concentration of the substance in the urine is plasma concentration is 1 milligram per ml. Urine flow rate is 10 ml per minute. And 1 milligram per ml is the urine concentration. So its clearance would become 10 milliliters per minute. That is, in 1 minute, 10 ml of plasma is being cleared of this substance inulin. If you recall this image, this is showing the filtration, reabsorption, secretion, and excretion of the substance. And we said that excretion of the substance is a matter of resultant of how much it was filtered, then reabsorbed or secreted. The concept of clearance can be used to estimate the GFR, renal blood flow, reabsorption, and secretion. And for that, we will take the example of these 4 substances. As we discussed in previous sessions, that filtered load is equal to GFR multiplied by plasma concentration of the substance, whereas excretory load in the urine is equal to concentration of the substance in urine multiplied by the urine flow rate. Now, some of the substances have filtration rate equal to that of the excretory load. Some have less filtered load than the excretory load, and some have more filtered load and less excretory load. If you look at these 4 images, can you figure out which substance is having any of these 3 characteristics? So if we look at substance A, this is a substance which was freely filtered, was not reabsorbed, not secreted, but excreted. In such substance, filtered load is going to be equal to that of the excretory load. The substance B and substance C were freely filtered, but then partially or completely reabsorbed, not at all secreted. So their filtered load is going to be more as compared to the excretory load, as it was reabsorbed on its way. Lastly, the substance T, it was filtered and secreted, but not reabsorbed. So its filtered load is less as compared to its excretory load. So if we know such characteristics of different substances, the clearance of these substances can be used to estimate different renal functions. For example, the clearance of substance A, which was filtered but not reabsorbed, not secreted, will be equal to that of the GFR, as filtered load is equal to excretory load. The clearance of this substance D, which was filtered and completely excreted but not reabsorbed, will be equal to that of the renal plasma flow, as the plasma is completely cleared of this substance. So the clearance of such substances can be used to indirectly estimate the GFR and the renal plasma flow. This is a non-invasive indirect method rather than using microelectrodes and invasive procedure to estimate the excretory functions of the kidney. Such substance A, example inulin, and the example of substance D is para-aminohippuric acid. So let's see, if we want to estimate GFR, how can we use the clearance of inulin? Here you can see the plasma concentration of inulin, urine flow rate, and the concentration of urine in the inulin. If you put all these in the formula, you will get the clearance of inulin, which is equal to the GFR. Inulin is, however, not produced in the body, and we have to inject it intravenously, calculate its clearance to estimate the GFR, which is exactly 125 mL per minute. This is the gold standard for estimation of the GFR, inulin. Other alternatives are given, for example, iothalamate, EDTA, cystatin C, and creatinine. Among these, creatinine is a very good alternative. Its estimation of clearance can also be used as an indirect estimate of GFR. But its clearance is not exactly equal to that of the GFR, but approximately equal. So the gold standard is inulin, but as we have to inject it intravenously, we can use the estimated clearance of creatinine as a good estimate. Why is it not exactly equal but approximately equal? Because a little amount of creatinine is also secreted in the renal tubules. Creatinine is produced by metabolism in the body, is widely used for GFR estimation, is relatively less precise because some of it is secreted in the renal tubules, so it can overestimate the GFR. But when we measure the creatinine concentration in the plasma, the lab mechanisms we have available slightly underestimate the GFR. So both of these cancel out each other, and we consider that creatinine is a good alternative to inulin for estimation of the GFR. For estimation of the creatinine clearance, we still have to have these three values: the urine flow rate, the urinary concentration of creatinine, and the plasma concentration of creatinine. Sometimes it becomes cumbersome to collect the urine for 24 hours and then estimate these values. To make it even easier, there is still even a simpler alternative, which is looking into the plasma creatinine concentration only. As you look into this graph, you can see as the GFR decreases, the plasma creatinine concentration increases. So if you find the plasma creatinine level of a patient is 7, you can simply plot this on this graph and have the GFR value approximated 20 to 25 milliliters per minute. Another person having 2 milligrams per 100 ml will have a GFR of approximately 60 to 70 milliliters per minute. So it is also a good estimate instead of the creatinine clearance. However, the gold standard remains the inulin clearance, followed by a good estimate by creatinine clearance, and still an easier way, plasma creatinine concentration. Similarly, if we use the type substance D, which is freely filtered, completely excreted, and not reabsorbed, the clearance of that substance will be equal to that of the renal plasma flow, and such substance is para-aminohippuric acid. It should be completely cleared off from the plasma, but para-aminohippuric acid is 90% cleared from the plasma. So the calculation we have, we call it renal plasma flow, and to account for the 10% which was not excreted, we can do the mathematical estimation. The clearance of para-aminohippuric acid is divided by its extraction ratio, which is 0.9 or 90%. By doing this, we get the estimated total renal plasma flow. So para-aminohippuric acid, despite being 90% excreted, is a very good estimate, because rest of the estimation we can do mathematically by dividing it with the extraction ratio. This is showing the summarized image of the uses of clearance. Clearance rate C is equal to UV divided by P. GFR can be estimated by clearance of inulin. Effective renal plasma flow by clearance of para-aminohippuric acid, and if we divide it by the extraction ratio, we get the actual total renal plasma flow. If we have the renal plasma flow, renal blood flow calculated can be calculated indirectly. Last three, excretion rate, reabsorption rate, and secretion rate, again the matter of logic. We will see it in a while. Filtration fraction we know is the proportion of blood flow which is filtered at the glomerular capillary. So if we estimate the clearance of inulin and clearance of para-aminohippuric acid, we can divide these two to get the filtration fraction as well. Now we will come on to the estimation of renal tubular reabsorption and renal tubular secretion from the renal clearance. As we know, filtered load and urine excretion rate. In case of a substance which was reabsorbed is going to have a higher filtered load as compared to the excretory load, whereas the substance which was secreted, its filtered load would be less as compared to the excretory load. So if we are given a substance, let's say substance X, we calculate its filtered load, we calculate its excretory load. By looking at the difference between the two, we can have an estimate if it was secreted on the way or reabsorbed on the way through the renal tubule. You can use these values to calculate the tubular reabsorption of the sodium. Simply calculate the filtered load, excretory load, and find the difference. This is the estimated clearance of different substances. Glucose clearance is 0 as it is completely reabsorbed, not excreted in the urine under normal circumstances. Filtered load of sodium, somewhat secreted. Chloride, potassium, phosphate, inulin, and creatinine. Inulin is that equal to GFR, and this is approximately equal to that of the GFR. The clearance of these substances is little less than the GFR, so they are reabsorbed to some extent. This is completely reabsorbed. And if the clearance of a substance is even more than creatinine, let's say 160, 180, this was secreted on its way. For example, para-aminohippuric acid. So match the correct pairs. The substance having clearance equal to that of the inulin, neither secreted nor reabsorbed. Clearance having less than that of the GFR was reabsorbed, more than GFR was secreted. And that's all. Thank you.